So recently I had a patient who is a known diabetic for the past 20 years and met an acquaintance who took an online program and was able to stop the diabetes tablets. This person wanted to try it and was put on a diet regime where her sugar medications were decreased and gradually stopped. Over the next couple of months, this person got symptoms of diabetes, and when the sugar was rechecked, fasting sugar was more than 200 and after food sugar was more than 300. So this has prompted me to discuss regarding precision care in diabetes. Hi, I am Dr. Nishchita, consultant endocrinologist in Bengaluru. Are all type 2 diabetics the same? No, in fact, clinicians who have treated diabetes notice that the way complications develop and the way diabetics respond to treatment vary from person to person. There have been studies to support this as well. There was a Scandinavian study where a big population of diabetics were looked into, and in fact they found 5 clusters in which they present. Cluster 1 was in fact type 1 diabetes, where there is autoimmune destruction of pancreas and insulin is necessary for treatment. Cluster 2 had insulin deficiency but they were antibody negative. Cluster 3 was the severe insulin resistance cohort, where obesity is present along with insulin resistance, and these people respond to medications. So cluster 4 and 5 were milder forms, where in cluster 4 there was obesity related insulin resistance, and cluster 5 had age related beta cell dysfunction and insulin resistance. Now this is the population where intensive lifestyle modification will work and they can go into remission and stop the diabetes medication. Now, why is this important? See, in cluster 2 and cluster 3, the risk of complications are high. When there is insulin deficiency, there is microvascular complication like retinopathy that the person can develop. When there is high insulin resistance and diabetes, the risk of kidney damage and nephropathy increases, and macrovascular complications like heart diseases, fatty liver, stroke increase. Now there have been Indian studies as well, in fact 2 landmark studies that have shown that Indians are more prone for insulin deficient state when they are lean and there is a younger onset of diabetes. The INSPIRED study in fact showed 2 novel cohorts in Indians where there is a coexistence of insulin resistance and deficiency. So the therapy for diabetes has to be individualized to each person, and in this era of information abundance, make sure you talk to your endocrinologist and do the necessary tests to see which spectrum you fall into so that the treatment is individualized for you. Take care.